Hello and welcome to the Princeton Spine and Joint Center podcast. My name is Inovi Mailer and I'm the co-director of the Interventional Spine Program here at Princeton Spine and Joint Center. And I just finished a podcast where I had a conversation with Andrew Appello. Andrew Appello is a clinical herbalist, an acupuncturist, registered nurse, and that's just scratching the surface. We had a great conversation. He has background in Ayurvedic medicine. He has extensive background in martial arts, which he ties into the practice of acupuncture, of herbal medicine. We talked about the application of acupuncture, its history. We talked about the applications, what one can expect if one was to go for the acupuncture treatments, including the sessions, including what to expect in terms of treatment duration, outcomes, what the scientific background for acupuncture is. Anyone who's interested in acupuncture, or for that matter, if acupuncture can be helpful for them, for their pain, for their anxiety, for stress, would be very interested in listening to Andrew speak, because he brings a lot of different aspects of his background to the conversation and enlightens us about acupuncture and its applications. Today joining me is Andrew Appello, who is a clinical herbalist, acupuncturist, and a registered nurse. Welcome to the podcast, Andrew.
Thank you for having me. Appreciate it.
We're going to talk about acupuncture today. So before we dive into the topic of acupuncture, let's talk about how you got into acupuncture. And you have a varied background. So just give us a flavor of what got you into it and what you went through and how you think about acupuncture.
Yeah. So as a child, I started martial arts and for many, many years and really got interested in not only the practice, but the philosophy of martial arts and yin and yang theory, just like in Chinese medicine is part of martial arts as well. And so I was always taught fundamentally healing and destroying were two aspects of the same coin. So to be a really good fighter, you have to be a really good healer and vice versa. I took that with me, never thought I'd make it a profession. Actually, I went to business school. And later on in my teen years, I studied with an Ayurvedic spiritual healer. I studied Reiki, energy healing. And then I eventually led me to Ayurvedic medicine and Chinese medicine and got a degree, post-grad degree in Oriental medicine.
Cool. Very cool. So a couple of different approaches to healing and Ayurvedic medicine. Just a couple of words about that.
So Ayurvedic medicine is actually a sister art of Oriental medicine from India. That comes out of Indian scripture. It's about 5,000 years old. We have written scripture from 4,000 years ago, maybe even a little more.
Cool.
Yeah.
Cool. Awesome. In terms of acupuncture, we know that this is something that is being used a lot now. But of course, this is not something that was developed several years ago or even 100 years ago. We're talking about thousands of years old of year-old practice. So can you just give us a glimpse of history of acupuncture?
Right. So let's say it's based on an ancient practice, folk medicine that actually stems back to also thousands of years ago, way before we even had metalwork. So before metalwork and we could even develop needles, they were using pieces of stone to puncture the skin. And, of course, back then it was about leaching evil spirits out of the body, to correct illness. And that gradually obviously evolved, but we now have a practice that is about being in harmony with the environment. So sleep-wake cycles and seasonal eating, a lot of the concepts that come into modern holistic medicine now stem from these ancient practices, both of Ayurveda and Chinese medicine. So after they developed metalwork, they started playing around with needles and inserting these, which we call them needles, but they're really just really fine pieces of metal, to affect the body, to create a balance in the body, to stimulate our own innate system.
Cool. And of course, bloodletting has been in practice in Western medicine for a while. I mean, even the journal, one of the famous journals in medicine is Lancet. And of course, Lancet was used for bloodletting and leeches and et cetera, et cetera. And in speaking of such, so you take this really old practice that has developed with development of metals and using the fine pieces of metals, and you're still using it with an approach that comes from that traditional, folk medicine, if you will. How does it blend in with the Western approach or with the Western medicine as we think of it? We think of it as traditional or allopathic medicine, if you will. So how do the two merge? And maybe let's talk first about what are the principles of acupuncture? Like you spoke about that balance.
Right.
So
I think there's a little more history lesson in there, right? So,
please, yes.
I think so these ancient practices kind of migrated forward, and eventually they started talking more about psychospiritual medicine, not, bleeding evil demons out. It is more about what are the emotional imbalances that cause our body to not function properly. Then fast forward a little more, well, what is the biochemical mechanism for our body to not function? And of course, they call it a chi imbalance or an imbalance of the blood because they didn't have science hundreds of years ago as we know it today. So they were trying to find a way to tap into that. And how to redirect the qi flow. That's the Chinese and Oriental way of discussing that. So where there's a qi imbalance, there is pain. Where there's pain, there's a qi imbalance or blockage. That's the traditional saying. So coming to the Communist Revolution in China, they realized that Western medicine was evolving kind of without them. And so Chairman Mao kind of had a delegation of people come together and say, let's define Chinese medicine. And they defined it knowing that Western medicine was the new thing coming out and in all of the world. And obviously they wanted to modernize. So we developed something called TCM, which is traditional Chinese medicine, which is what the standard of education around the world. Everybody that's an acupuncturist learns TCM at least, but that's only one style. There are many other styles. In school, I studied 3 different styles, TCM, a Japanese style, and a Western osteopathic-based style, actually, based on trigger point therapy. And then from my martial arts background, I studied Dieta, which is traumatology, hit and fall medicine. We take all these things, wrap it in a nice bow with Western medicine, and they start saying, here in the West, we talk about disease. In the East, they talk about patterns of dysfunction. We don't really like the word disease. There's a stigma against that. But nonetheless, it kind of emerged even in TCM in Chinese medicine. So how do I treat a headache? That's the disease of the headache, right? How do I treat this, the other thing? The traditional Chinese way of looking at it would be, how do I treat the imbalance of the foot meridian of Jueyin, which is and other Chinese words like that? Or how do we treat this kind of pattern of dysfunction? And
sorry to interrupt, but the meridians. So you spoke to the meridians. Can you speak just a little bit more about that, just so to get a better sense of it? The meridian is part of that flow of qi, that energy, right?
Right. So the Chinese, over thousands of years, and this is really empirical medicine, tried to map out these sort of ley lines of energy. It's sort of like how we could think of a blood vessel. It follows a pathway and there's a fluid flowing through it. So the metaphor in the classical text is like rivers and streams and oceans. They use those analogies. So these meridians are reservoirs that flow like to varying degrees, little streams, big oceans. And we're trying to tap into that. By tapping into that, we use these little needles. But there are other methods. We could use herbal applications to stimulate heat, moxibustion, which is a kind of way of a heat therapy as well. We could use pressure with our finger, all different kinds of ways. We're trying to redirect this flow and again, correct it so that everything can be more balanced. That's the Chinese goal of what we're trying to do from an Asian perspective. When you look at that from a Western perspective, that makes no sense. But if we think about it, we're causing microscopic tissue damage, really small, right? Really, you can't see it. You don't bleed from it. You just have a little tissue damage. That creates an inflammatory sponge. It creates migration of immune chemicals. So you're stimulating the body in some way. We still don't know how, but we're stimulating the body in some way with the hope of guiding it towards healing.
Awesome. And that really brings us back to kind of to what you started talking about and looking the way we usually in Western medicine look at a headache, a pain in the back, in the shoulder, wherever that is, and looking at that as a starting point as opposed to the way the traditional you would say meridian paths. So with that, just before we started the podcast, we touched on a couple of things in just talking, and you had mentioned being able to overlay the nervous system and looking what we know from anatomy at this point from the Western perspective and from all the dissections and everything else. The overlapping understanding and knowledge of that nervous system with the traditional meridians and so on. So could you speak to that?
Right. So if you dissect a body, you can't find a meridian. Right. And so that's one of the arguments like, well, this is kind of voodoo. But when you put the map of the major points and the meridians on top of an anatomy chart, you could put a chart of the map of the blood vessels, major arteries primarily, and the nervous system. Most of the points are near major either where the nerve splits or major arteries. So, for example, a really important point for us is behind the knee in the popliteal fossa, where we have the popliteal artery, the popliteal nerve, and we use that to get a real big bang for our buck because we're right over top of two major anatomical landmarks, and we use that for a point for treating the low back. Tangent on that, fast forward to another part of our discussion that we're going to have. Now we see urologists using P10s, posterior tibial nerve stimulation for overactive bladder. And that was actually stolen from acupuncture originally. And then someone patented a device on it because you can't patent acupuncture, but you could patent a stim device.
Right.
So what they're doing is they're sticking a needle on the inner shin, right by this nerve, to try to send a signal to the bladder to relax, to stop contracting and spewing out all of the urine so you have overactive bladder. And it's really interesting because that was a Chinese concept that has been done for thousands of years,
right.
In some way, whether it's through heat or manipulation of the point or needling. And now we're just kind of realizing, there's some application. And the studies that came out on that showed that there was better effect with that than some of the medications, which is also very interesting. So this voodoo that came about thousands of years ago that started with leeching spirits, we're starting to find with research that there is some basis for it. We still just don't know how. We don't know exactly what that is, but we know it has an effect.
It's very impressive, right? I mean, if you think about thousands of years ago if they weren't doing a lot of detailed dissections and how they came up with points that now really correspond to a lot of the detailed things that we know about anatomy. And even though we're learning, as much as we know about anatomy, we're still learning about anatomy just structurally, because just about 3-4 years ago, we just found out that the 4 major ligaments that we know are in the knee, they're not 4, there are 5. There actually is a subligament that was just discovered. I mean, we're talking about just now discovered. Right. So we're still discovering.
After millions of knee surgeries. Right?
Exactly. and now you're looking at this thousands of years of experience, and they're coming up with such a detailed points that correspond to the nervous system and so on. And it just, of course, historically, that's interesting because there's almost nothing that's really truly new, because we know that in Egypt they were performing cataract surgeries or eye surgeries and brain surgeries, and this is thousands of years ago as well. So,
and Ayurvedic medicine has the oldest record of nose surgery, rhinoplasty. From I want to say 1500 BC, I believe, is when it was performed. So these ancient systems, they were medicine of their time. They're just not recognized as such now because we have science, But that was the science. It was empirical science. They were just observing what happened in nature, seeing if we can connect our human experience to what's going on around us in the world, and learn from that to see if we can correct our own health and our own patterns of dysfunction.
Which is interesting, the way that most of the medical discoveries were historically is not the pattern for a lot of research currently. And I know it's off on the tangent, but it used to be the observational medicine, right? The empirical medicine and the observation of nature, observation of what's happening and how someone responds to certain influences, whether it be bleeding or affecting a certain point or inserting a fine metal object. Whereas then, in sort of reverse engineering of why does it work and how does it work, now that we know that it does, as opposed to a more current confines of we need to establish the mechanism of action before we can start doing experiments or observation, which is, of course, not the way most of the observations were obtained in medicine and
Right.
for
So
thousands
that's,
of years.
that's the Western reductionist model,
Yes,
right? We
yes.
want to isolate that virus, the cell, the chemical, and the receptor site, so we could target it with some sort of therapy, whatever that is. And in holistic medicine, all forms of it throughout the world in history, it's quite the opposite. It's really looking at the bigger picture, and that's why we use that pattern to dysfunction term. How do we function as an organism? So I really like physical therapy. I really love osteopathic medicine because we look at the whole kinetic chain, for example, if you have a musculoskeletal dysfunction. So if I have a back problem, I'm going to start looking at how my feet are. How is that working? How are my knees sitting? Is everything lined up straight? Am I using my muscles in a balanced way? And acupuncture has always been doing that. So if I have a back problem, I'm going to treat along the whole leg where the muscles are spasming on one side, and then probably cross over to the other side and treat the other side as well, because everything is linked together as one as a bigger picture.
And some of the researchers that I've talked to have said that it sort of ties their hands because they're not able to do observational research.
Right.
They have to show the mechanism that they expect
Sure.
or that they have proven somehow before they can start observing. Speaking of which, so now that we have this thousands of years of history and thousands of years of experience and observational techniques that have been shown to work, now you come into the Western thinking of medicine, and we know that the acupuncture in itself has been studied. There were numerous empirical studies that looked at efficacy and so on. So can you speak a little bit about that and to that point, what we know from the scientific community looking at acupuncture, almost some looking from outside in and just trying to say, okay, it seems to work. Let's
Right.
see, does it really work, or is it placebo?
Right.
What does it do? So
Yeah, it's interesting. When I first started practice, there's research, not a ton, right? And then a couple days ago, I was trying to just did a general search for the last 10 years. I searched the word acetaminophen, which is Tylenol, and I got 3,000 articles. I searched the word acupuncture, and I got more than 10,000. So which is just kind of interesting because that shows, wow, we're really starting to get interested in the Western scientific community. We really want to know because we see the value in it. And even the CDC has with the National Institutes of Health, has a really great website saying acupuncture is really worth a shot, essentially. For this, and this, we know there's a plethora of research showing that it can help. And then maybe for this, and this,
And sorry to interrupt, but CDC, right? It's a United States agency, right? The Center for Disease Control, which really researches and makes a statement for U.S. And just to make it clear for the listeners, when we talk about Western medicine, we're not really anymore talking about geography, because in fact, those 10,000s of studies have come from across the globe. Because now researchers are doing this. This is happening in Taiwan. This is happening in China. This is happening in Japan, in their academic centers. So even though we're speaking of this as Western, we're no longer talking about geography. We're just talking about the approach.
Correct.
Right. Just to be clear for our listeners that we're talking about the approach, and this research, this scientific and clinical research, is happening across the globe from every part of the world. And as clinical science, as scientific community has to do, they are cross-checking and cross-referencing. And when a study comes out and it shows some effect, it is then checked elsewhere in a different independent scientific community,
right,
and then published.
For example, there is, I want to say somewhere in Northern Europe, there was a female neurologist who did some research on adenosine and seeing how acupuncture affects adenosine, which is involved in pain transmission. There's people researching about the gate control theory. So essentially that tells us if we distract with a non-noxious stimulus, we can block pain in that nerve.
The way supposedly the TENS unit was developed and worked through.
Right. And I certainly see that.
TENS unit is electrical stimulation, transcutaneous electrical stimulation. Yep.
Right, and I see that on a daily basis. So it's interesting because research is wonderful. We need research, but I also am like, well, that's nice. I see that all the time. Why don't I need research to show me that I just did that?
Right. Yes.
So we can distract the nervous system to calm pain signals, but we think that more than that is happening. We know that acupuncture stimulates the release of opiate chemicals, endogenous opiates, so pain relieving chemicals that our body naturally makes, which which is another reason why national and international organizations in our opiate epidemic are recommending acupuncture as a trial therapy for people with chronic pain because it's showing
Absolutely, yep.
promise.
Yep.
And there are really no downsides. The worst, you could get a bruise. That's
Right.
really the worst kind of downside for acupuncture. Opiates, much bigger downside.
Right. As we
Yeah.
yes, as we're learning more and more about the the nature of the epidemic that's hitting U.S. and
Right.
in the world as well.
Right. And so we are starting to see research now. So for example, we know that in the insurance industry, in order for our care to get paid for, it has to have evidence backing the care. So acupuncture in the US, we are a baby profession in the healthcare industry. We are probably the newest that is licensed profession around the country. And so we are still new to the insurance industry. Some insurance will not cover it. Medicaid, Medicare will not cover it, but then a lot will. Some insurance companies will only cover what there has been research for. So it's kind of a little hairy, but they will cover chronic low back pain treatments, for example, because there is so much research showing that acupuncture has benefit. They can't say no to that. It will definitely often, not definitely, but often cover neck pain, migraines, chemo and therapy induced nausea, pregnancy induced nausea. These are conditions, osteoarthritis in the knee. So even the most limited insurance carriers that have some acupuncture coverage, they will cover for those conditions. But then there are a lot of carriers that are covering just anything related to pain because that's what it's in general most well-researched pain conditions of any kind.
Sure. Well, since we touched on that, and the reason, of course, is for the scientific research is to for all of us to be on the same page, right?
Right.
Is for everyone to be able to talk about different modalities as efficacious, and of course, we want to know that there is some efficacy behind treatments, and of course, it is far more important to know when we're talking about things that carry a lot of negative and positive. Right. So when we're talking about a surgical procedure, when we're talking about high dose medications, and of course, once we get into chemotherapies and so on, that have a lot of detrimental effects on the physiology and side effects, etc. With acupuncture as well, although you're looking at a very significantly lower downside, right? So that scale when you're going pro and con is most commonly going to significantly outweigh the pros are going to outweigh the potential con.
Right.
And most people are surprised that, when you're talking about needles, that there is no bruise and there isn't that much pain involved in it.
Right.
But you talked a little bit about some of the things that acupuncture can be used for. So maybe you can talk a little bit more to that. Just what else can acupuncture be used for?
So some things that people don't actually realize, even my own clients who come to see me, they'll say, "Oh, I'm stuffy today." I'm like, "Okay, let's work on your sinuses." And they're surprised that the needles can actually help loosen the fascia enough that sinuses can start draining. Sinusitis of various kinds, not necessarily infectious, but allergic sinusitis, I treat all the time. I help a number of people with asthma symptoms. I have people that when they come regularly, they notice they're using much less of their asthma medication. Again, pain is the most well-known. So if it's a pain syndrome, you could, if you could name it, I could probably have seen it. Complex regional pain, CRIPS, which used to be RSD, regional sympathetic dystrophy.
Causalgia and RSD, which is now CRPS1 and CRPS2.
Right.
Yeah.
Now they're subdividing it because we don't know what they are.
Right.
So we're trying to figure that out.
But the theory behind those, of course, is the sympathetic parasympathetic balance, which goes to the balancing point, which makes sense that when you're able to balance certain things that acupuncture is able to affect, then once you start talking about balancing sympathetic parasympathetic outflow, you should be able to look at it from that perspective, and it makes sense that you would address it.
And that's another condition that people come to me for, anxiety, stress, stress alone, because when you're releasing pain relieving chemicals into your system, you relax. So it's funny. It's a joke in our office, but like, that person had just got their treatment because they have acupuncture brain fog. They stumble out of the room, sometimes walk into walls. They're just so relaxed. That's definitely a side effect, a good side effect.
Right.
And there's times where I have to make people wait before they drive home.
To that extent, okay.
Yeah. So if you're that relaxed, you're certainly not running away from the bear in the woods, which is our sympathetic nervous system.
Right.
Your rest and digest, the parasympathetic, is kicking in. Pain is relieved. So there's a broad application for that, really broad, actually.
And you also said about the hyperactive bladder and urology.
Yeah, bladder issues, acid reflux. I have a number of people who come to me because they don't want to be stuck on their proton pump inhibitors.
Right.
And I
And
work
in
with their
pregnancy, so
gastroenterologist.
you mentioned pregnancy. So, of course, in pregnancy, the woman who is pregnant is limited significantly in terms of the medications that she's able to take,
Right.
and interventions that are that you can use, because number one, whenever you use an intervention, you're using a medication that most of them cross the placenta, most of them
Right.
can affect the fetus negatively. You also at times need guidance, so that's radiation that you cannot expose her to.
Sure.
So there are a lot of limitations in terms of nausea, in terms of pain, in terms of a lot of things. So you can safely use acupuncture for
Absolutely. Pregnant women come to me all the time for low back pain and sciatica.
Right,
That's
right.
the number one reason they come to after the nausea ends.
Right.
They came to me for the nausea, but then they realized they had to stay for the sciatica because that's the biggest issue that they experience from the uterus growing and structures pressing on their nerves. And I can do it really effectively, actually, because it's just simply releasing muscles and having that space for the nerve to breathe, so to speak. And then the pain goes away. It's just so amazing working with pregnant women, actually, because they respond really quickly.
Right.
All the hormones of pregnancy make it even easier for me.
Cool. That's very cool. And not only that, but also you become one of the very few people that have a tool that can help them.
Right. With no side effects that
Right.
cause risk to the baby at all or the mother.
Are there ever any concerns? Are there ever like high risk pregnancies that you would ever need to talk to the
Not that I've
obstetrician?
encountered so far.
Okay.
Because the reality is, if you think about something like sciatica, I'm releasing the piriformis muscle, which is just a muscle deep in the glutes, behind the glutes, that is what's pressing down on that nerve. There's no danger. There's a pelvis in there, that blocks and protects the baby. So it's a pretty safe procedure for probably anybody.
Cool.
Yeah. And another aspect to women's health, that has some research to it as well, is with IVF. Acupuncture and IVF is a really hot topic. And I have colleagues that are only seeing IVF patients. That's all they do for their entire practice with acupuncture, working along with the fertility docs. There have been several studies. One showed a 25% increase in success rate of implantation. Another one from Germany showed almost 50% increase.
So we're talking this is done in parallel with IVF trials
treatment.
and treatments and
Right. And so when you're talking about a procedure that can cost 60 to 80,000 out of pocket, a 25% increase in success for a few acupuncture sessions, a couple times a month is really helpful.
Yes.
So I have a lot of women that do actually come to me for that as well. And I do see that it helps.
well, from every perspective, right? I mean, for them to conceive, for cost
Right.
benefit analysis,
Sure.
and anything in between. So you started talking about what you release and how you release. So a common question that I usually get asked whenever I refer someone for acupuncture is, what am I to expect? Like what does an acupuncture session look like? So can you speak about that a bit? What can someone coming in for an acupuncture treatment expect?
Sure. The way that I work is acupuncture, absolutely. A little bit broader than that as well, though, because I've had studies in functional medicine. I studied two different styles of Western herbal medicine and Chinese herbal medicine as well. So I'm that eclectic practitioner.
Right.
So when someone comes in, I sit down with them and talk and really try to figure out what the best approach is for them. Sometimes it doesn't involve acupuncture. Sometimes it's diet changes. Sometimes it's nutrition. Sometimes it's supplements. It could be herbal medicine. Okay. Of course, I'm biased because I really like the acupuncture. So if I could get everybody to get acupuncture, I'd be happy, because just for the stress relief alone.
Right. Yes.
But, so they come in, we talk, and then especially for pain issues, I palpate. I feel what their tissue is doing, and I go ahead and perform it. Usually I start dive right in and try the treatment. And there's a teacher, a famous Chinese acupuncturist, said, if your treatment worked, your diagnosis was correct. We have this obsession with getting the right diagnosis so that we can then do the treatment in Western theory.
Right.
Acupuncture is the opposite. We just try the treatment and say, okay, let's see if we were right.
Right.
So people often ask me, how many times do I need to come in? And I say, well, I don't know. Let me try a treatment and see how you respond. Let's see how your body does with this. And then I'll get a better sense of understanding what we need to do from there to continue progress.
I see. So in many ways, it sounds like very similar to sometimes what I need to do in terms of pain, determining pain, and really sometimes it's an algorithmic approach because there is so much crossover between pain generators and talking about pain specifically. And what it seems like or sounds like to me is that to some extent it's like an algorithmic approach where you take one step of the most likely path that's going to get you to where you need to go. And if you haven't succeeded, it doesn't necessarily mean that you haven't succeeded. For one, it's
Right.
kind of a dual purpose, right? For one, you've eliminated one option that doesn't work. But a lot of times, at least with my procedures and my tool set, if you will, sometimes you get a partial response in which you get some positive response, and the negative response is not really negative, but it actually points you in the
Right.
right direction. Is that
Absolutely, because I have my hands to work with as an acupuncturist. What I feel under my fingers, what the person's body tells me is the most important information to me. You can tell me everything, but your back tells me more.
Okay.
That's what I tell people.
And that's your functional background, and then that's kind of the osteopathic and
Yeah. The school I went to, the founder of the school, who actually was one of the people who got acupuncture licensed in this country, he was really a big lobbyist for our profession. Studied with Travell and Simons, the myofascial trigger point people, and so that was a huge part of our curriculum because. You can treat so many different conditions from a structural approach. And that first treatment I'm doing with someone, I feel what is going on with the tissue. I'm looking for the taut bands. I'm looking for trigger points. I'm looking to see if there are fascial adhesions that I need to release, if there's tissue that feels like scar tissue from surgery. And I can correct the structure by releasing those things. So my first approach is usually to start releasing tissue. If I feel that's what's going on. If it's more of an inflammatory component and the structure is not so much as much of the issue, then I work more on inflammation with nutrition, lifestyle, supplements. Often I do both. That's really my bias because that's the holistic approach. I want to make sure that your pelvis is lined up, that your muscles are not spasming, and then I can put some anti-inflammatory supplements into your diet. So we can take that holistic approach and really try to get as much benefit as we can and help the person as best as we can.
Awesome. Well, because nothing works nothing is in isolation, right? So
Right. And I see that all the time. You could do your pain injections, that takes down the inflammation. That's great. But how do we have to correct the way the person walks so that it doesn't come right back. So that's another thing. So postural correction, I'm really, really big into as well. Having people walk with the right part of their feet, having them hold in the core, things like that. I think that's all part of a program that should be used, which is why I love physical therapy too.
Right,
And
right. No.
interdisciplinary therapy is, I think, the best.
Yeah, absolutely. The analogy that I usually use whenever there's inflammation and when I see someone that needs some intervention to take away the inflammation is that I usually talk about putting the fire out, right? And I usually will explain that this is very effective, but it's a tool. It is a tool in the continuum of care. And the whole idea is that fire that started this whole thing, and for instance, let's say low back pain, let's say it's sacroiliac joint or facet-mediated pain. So when you put that fire out, even if you put that fire out quickly and soon, which doesn't usually happen because I usually see people that have had this for at least a bit, they've already developed some compensatory mechanisms that were useful at the time to get them around, but they now hold on to them, and now you have to undo that and sort of relearn and undo and sort of some myofascial patterns that have been established in response, which were useful.
Right.
But no longer.
There's a lot of retraining, both through what I do with the needling and through what I do with helping people relearn their body in a lot of ways. And I really try to impress upon people that I think that a lot of our problems are self-imposed.
Right.
If you walk around with a limp, 30 years later, you're going to have back pain. But if you walk in a balanced way, you stand a chance of having a healthier spine. So I think that a large part of what I do is that, trying to empower people to show them you have the power to also correct this yourself. It's not me. Only, I'm just helping you, you're helping me, we learn from each other. So I hope that people get that message always.
So there's a bit of coaching on your part.
Absolutely.
Like a personal coach for
Right. I mean,
propagating.
if you're having chronic back pain and it's inflammatory back pain and you're eating sugar all day long and you have, pre-diabetes, that's not helping your cause. So we have to look at all the aspects of our lifestyle to really get a comprehensive plan, especially for people who have chronic pain and are really suffering. Just a pill, just an injection, just an acupuncture might not be enough. They have to take care of themselves as well. Yeah.
Right. And you almost completely answered the question that I was going to ask you right now, but I'll still ask it, although I have a feeling I know the gist of the answer. I get a question sometimes, and sometimes people will come back, say, we've done the treatments and things are looking up and better. 3 months later, The person comes in, I'm feeling great. And my question is, great. So why are you here? So, and the answer usually is, I'm concerned. And the concern, of course, is what if it comes back? And what do I do? Is there value in doing maintenance? Like, let's say if we needed to do some kind of a procedure, some kind of an interventional procedure, should we just do one just in case? I don't want this coming back. And my answer, of course, usually is no. There's no value in doing maintenance. It's like doing maintenance surgery. You don't correct something that doesn't need correcting, which is different from, let's say, acupuncture or the more holistic approach. So what do you say to that?
Right. Well, that makes sense, because if you're putting a drug or doing an invasive procedure, obviously you don't want to do that preventatively unless there's a really good reason to.
Right.
But acupuncture doesn't have that risk benefit, right? Like we mentioned before, because there's very, very, very low risk, almost nothing, and potentially very good benefit. Maintenance is a really good thing. So I tell people, how many times are you going to go to the gym? Until you lose the 20 pounds or for the rest of your life?
Right.
Bicep curling twice gets you strong, but bicep curling for 20 years gets you really strong.
Right.
And so we can't eat broccoli one day, that kind of thing.
Sure.
So I think that maintenance is useful. The interval of maintenance is very individualized. So a lot of people will come about once a month once their problems are solved, let's say, or corrected enough where they feel well. But again, that could change. I have some people that like to come more than that, even though I say, don't worry, we're okay. They say, no, I want to come more because they have benefit beyond just the pain relief. They'll end up finding out that, oh, wow, this really helps my stress. It helps get my shoulders out of my ears. So from all of the work that I'm doing, often people end up directing their own plan because they feel the benefit, and the benefit could be anything. That's an open-ended statement there. And then they end up saying they want to come in more. And sometimes people will not come for maintenance. And that's fine. I'm happy to help them however they want. But then I do find out they come back at some point and say, oh, now I'm hurting again.
Right.
And I said, well, look, you're limping again.
Is that whole chain going out of whack again?
Which happened first, right?
Yeah.
Let's get back on track. And after the one or two times of that happening, then I think they usually start to realize, okay, let me just keep coming for maintenance periodically so that I don't have to get to the point of pain.
And at that point, you also can discuss with them everything else that you just said, in terms of many other dietary changes and gait changes and so on and so forth. It doesn't have to be one specific tool.
Absolutely.
Okay.
No, it has to be individualized, because for one person, it could be the walking on their left leg too much. For the other person, it could be eating cake every day.
Right.
What's your Achilles heel? I know mine.
Right. And that's also somewhat of a moving target, right?
Right.
Because the Achilles heel doesn't always remain in the heel.
Right.
sometimes you start putting too much weight on the left leg, only to go to the fridge more often and eat that cake.
Right. And that comes down to the Oriental and the holistic medicine theory of community as part of healing.
Right.
We have to be there to constantly help each other. And I think healing in medicine is no exception. Just like we need to support each other, the one person has one profession that supports another profession. The healers help the laborers in history throughout society. That doesn't stop because we're in modern society. We really do need to have a working relationship. And I think acupuncture lends itself nicely to that, because you can work together over a long period of time if that's necessary.
Yeah, and that relationship, as you've developed that relationship, of course, that goes back to a lot of different things that we know and learning more and more about by studying the longest living populations, right? Populations that have the longest living individuals, and what we're learning is the common thread among them is the societal ties and the family ties and how people complement each other's lives and so on. And
Right. We know that isolation is a key factor for creating depression.
Right.
Or a risk factor for depression. So, I studied with a man who is Cherokee, an herbalist, and the Cherokee believe that depression is as a disease of society. It's not serotonin. That's the problem.
Got it. Yes.
So their treatment for depression is ceremony that involves the entire community. So it takes a village, kind of that kind of expression. And I think that's true for everything. We really need to work together to maintain balanced life.
Doesn't just take doesn't just take a village to raise a child. It takes a village to maintain an adult.
The child, right.
Great. I think we covered a lot of ground. I think this is going to be helpful for anyone who's interested in acupuncture. So thank you very much for that.
Yeah, you're welcome. Thank you for having me.